Hello and welcome to this lecture about insomnia and treatment of insomnia. My name is Erla. I am a clinical psychologist, PhD in sleep medicine, and my expertise is in insomnia and cognitive behavioral therapy of insomnia. The main learning objectives of this talk is to understand clinical guidelines in the treatment of insomnia and to get an insight into hypnotic use, recommendations, and risk factors. Insomnia is often a very persistent disorder, with studies showing that 50 to 85% of individuals continue to experience symptoms for at least a year if insomnia is left untreated. Even after improvement, there is a high risk of reoccurrence, with 25 to 50% of people relapsing within a few months to a year. This chronic nature of insomnia leads to ongoing daytime impairments, such as cognitive decline and mood disturbances, and it is resistant to spontaneous resolution. Effective management, typically through targeted treatment, is crucial to address this long-term condition. Insomnia is a very common issue in primary care, where most patients seek help, with up to 50% of patients experience some symptoms. However, it often goes under-recognized, under-diagnosed, and under-treated in primary care. Despite 75% of patients reporting insomnia as a problem for over a year, only about 11% discuss their problem with their physician. This highlights a significant gap in addressing these conditions in the healthcare setting. In primary care, hypnotics are the most commonly prescribed solution for treating insomnia. However, despite the strong evidence supporting the effectiveness of non-drug treatment, very few patients presenting with insomnia in primary care get this kind of treatment. This indicates a significant gap between the treatment methods that are most often used and those that have been proven to be most effective. Hypnotics can be effective in the short term for improving sleep quality, reducing sleep latency, and increasing total sleep time. But these medications are typically prescribed for short-term use only, and patients should only use them for 2 to 4 weeks. And this is due to potential dependency, tolerance, and withdrawal symptoms and negative side effects. Hypnotics can lead to physical and psychological dependence if they're used for extended periods, and tolerance can also develop, making the drugs less effective over time. Common side effects of hypnotics include drowsiness, dizziness, memory problems, impaired coordination, and we can see that this increases the risk of falls, especially among older adults where hypnotics are frequently used. There can also be the next day drowsiness, leading to potential safety concerns such as impaired driving. Discontinuing hypnotic medications, especially after long-term use, can cause rebound insomnia, where symptoms worsen temporarily. These charts illustrate the usage of hypnotics across the Nordic countries. As we can see, Iceland has the highest usage per capita, followed by Norway and Finland, and Denmark has the lowest overall usage. Clinical guidelines for treatment on insomnia emphasize a comprehensive, evidence-based approach called cognitive behavioral therapy of insomnia, or CBTI. Where CBTI is not accessible or insufficient, short-term use of hypnotics medication can be considered, but they carry risks such as dependency and side effects, as mentioned earlier, and guidelines strongly highlight the importance of evaluating and treating any underlying medical or psychiatric conditions that may contribute to insomnia. Overall, a personalized treatment plan that includes behavioral strategies, lifestyle modifications, and when necessary, medications is recommended for the management of insomnia effectively. So cognitive behavioral therapy should be the first-line treatment, both for patients with primary insomnia, but also for patients with comorbid insomnia. CBTI treatment is highly effective, but it faces some significant accessibility challenges. There are too few specialists available to provide CBTI treatment, making it a scarce resource. The treatment is often very expensive. There can be long waiting lists, which further limits access. Additionally, CPTI is not typically available in primary care settings where most patients first seek help for insomnia. These barriers prevent many patients from benefiting from the evidence-based treatment that shows the best results in long-term relief of insomnia. Digital treatment could be the solution here, since studies have shown that online CPTI can effectively improve various symptoms of insomnia, such as insomnia severity, sleep efficiency, sleep quality, and sleep duration. The results are comparable to face-to-face CPTI, with benefits generally maintained up to 48 weeks post-treatment. So it's a very good way to use internet-delivered CPTIs as an effective and viable treatment options for insomnia to increase the access to the recommended treatment. So to conclude, chronic insomnia often requires treatment, with clinical guidelines strongly recommended cognitive behavioral therapy for insomnia as the first-line option. Despite of this, hypnotics are widely used and often the only solution offered in primary care due to the limited accessibility of CPTI. Digital solutions such as online CPTI could bridge this gap and provide a more accessible treatment option for patients. I want to present you with an assignment which involves working in small groups and discuss and develop strategies for implementing clinical guidelines in the routine care of insomnia. Each group will present their proposed solution and strategy plan, outlining how to effectively integrate these guidelines into clinical practice. Thank you very much for your attention.